going to share my slides. And hand it over to David to kick us off.
Great. Thank you so much, Andy. And we just, want to start off by saying that we're really happy to be here. This is such an important event for the field, and really appreciate the invitation. We do want to give some shout outs to the Elder Justice Initiative and Office for Victims of Crime, as well as Talitha and Shelley and the organizers of the summit, and Saxon One for all of your help organizing this and getting us prepared. So thank you very much. We're really happy to be here. So we'll start this off. I'm going to go first with a few slides. Patty, and I'm going to be the annoying person that says next slide, please. And yeah, you can keep going here, and then I'll pass it off to Patty in a little while. But I'm going to start off talking a little bit about some of the research origins that have really helped inform, what really is a highly client-centered approach that we use with RISE. And as you'll see, that comes from both doing interviews with survivors themselves, as well as more quantitative data, survey-based data. Next slide, please. We also want to send a huge thank you to our funders of the RISE work, so the Administration for Community Living. We really could not have done any of this without you, as well as the Public Health Agency of Canada. So thank you very much. Also want to recognize our larger RISE collaborative team. Many of you would know these people, and the really kind of special thing about our team is that we do come from very different disciplines, different perspectives, different kind of areas of expertise, whether it's research or kind of practice or operations or policy, and sort of different disciplines as well. And I think that's been really, really helpful. Next slide, please. Okay, so I guess just kind of taking a step back, before we started to design RISE, we did try to embark on some research that would help us inform how to design the model. Next slide, please. One of these studies was this this study in across New York State. It was a population-based study that used a fairly large random sample of older adults, and we asked them questions about elder abuse. And one of the things that we asked, after we kind of asked them a few questions about whether they were experienced specific mistreatment behaviors that kind of made up these different mistreatment types, there was a follow-up question that then asked them, well, okay, so they've said yes to a certain mistreatment behavior, which is from a validated tool, the conflict tactics scale, and as researchers and professionals, most of us kind of thought that if you answer yes to this question, then for sure that's a problem, and we're looking at a victim of elder abuse. And but we've then asked this follow-up question, basically from your perspective, from the older adult's perspective, how serious a problem do you feel this is for you? Next slide, please. And to our surprise, we found that you can see these categories. So one, not serious, somewhat serious, and very serious. If you add up, so the most common response here was not serious. And again, we were using relatively conservative thresholds to define victimization. So in this case, we're using the conflict tactics scale. It's a validated tool. It's been used for decades. And we set a threshold that they had to report 10 or more events in the last year. Okay, a lot of other studies are saying 1 or more. So this is a conservative threshold. But even with that threshold, we found that the most common category is that it was not serious. And then, Patty, if you want to just Go to the next slide. You see the same thing across each subtype. So this is physical abuse, and then next slide. This is neglect. I don't think I included all the subtypes, but you get the picture here. And what this made clear was that the way that um, victims themselves perceive the problem is often very different from the way that we as researchers or professionals might be looking at the problem for them. And it kind of shines a light on this kind of dilemma that we're always working with in our cases, that like we think we might know what's best, but we don't know what they're thinking unless we really listen. Next slide, please. And then when we tried to look at the factors that sort of predicted whether or not somebody appraised their situation as not serious or serious, these were some of the findings, and some of the more consistent findings was the nature of the relationship between themselves and their harmer. Specifically, if it was a more sort of a closer offspring related relationship, so if the harmer was a child or a grandchild, they were significantly less likely to see the situation as serious. In other words, if it was like a paid caregiver, for example, they were more likely to see it as serious. And so again, and then another kind of finding that is sort of whether or not they live together. If they were living together, they were significantly less likely to see the situation as serious. And I think this really starts to bring kind of forward some of the complexities of the cases that we work with. We're working with really complicated family relationships a lot of the time. A lot of our cases involve adult children who might be living at home, and there's dependencies going in both directions. And so it's not just as easy to say like, oh, well, for the person to recognize for themselves, I'm a victim of elder mistreatment. This is the problem. I need to stop this. I mean, that's just not the way it works in these scenarios. Next slide, please. And then we conducted interviews with survivors of elder mistreatment. And by the way, this work was funded by NIJ. We asked them, because we know that one of the hardest things, arguably the biggest challenge in this work, is just engaging people into formal support services. This is often a reluctant client population, not an eager client population to receive services. So we were asking them, like, what are the barriers to engagement? And what are the most distressing aspects of victimization? If we know this kind of information, then it helps inform how we design an intervention. And you can see here that we're dealing with some really sort of powerful and kind of profound psycho-emotional challenges. Older adult victims are dealing with feelings of shame, with guilt, self-blame. I raised this child. I blame myself for the way they're behaving. There was a very common theme of concern for others, for the harmer, that I want them to get help. And so, and often putting the needs of the family in front of their own needs. So we realized, and next click, please, that if we're going to design something, it has to go beyond sort of arm's length case management. That if we want to try to do this well, it's got to have the capacity to sort of be able to address some of those difficult psycho-emotional and social challenges, when appropriate, to work with others in the case, and to have kind of a recognition that in many instances a restorative approach is what the older adults are looking for, and to sort of be able to respect that from a client-centered perspective. Next slide, please. And it's at this point I'm going to actually hand it over to Patty.
Great. Thanks, David. So I'm going to take you through some slides that talk about what RISE is in practice, and share some case examples. So what is RISE? RISE is an intervention designed specifically for older adults experiencing abuse, neglect, self-neglect, and exploitation. It's a direct service program led by a team of specially trained advocates. And as David said, while it may look like case management on the surface, there are key differences. Unlike traditional case management, RISE advocates are not focused on service coordination, eligibility, or discharge planning. Case managers play a vital role in helping clients access services and navigate complex systems. RISE complements that work by offering sustained relational support rooted in trust, autonomy, and client-defined goals, especially when traditional service pathways are limited, have ended, or have not yet been accepted by the client. Advocates build deep, trust-based relationships with clients and stay with clients for as long as needed. A key distinction of the RISE model is that we can also work with individuals who've caused harm in cases where the older adult requests it. Again, speaking to what David referenced. This is not typical in most service models, but it reflects RISE's commitment to relational and restorative approaches, trust-based relationships with older adults navigating abuse, neglect, self-neglect, and exploitation. Each advocate is trained in the RISE model's 4 integrated modalities: restorative justice, motivational interviewing, teaming, and supported decision-making. They support clients in defining their own goals and walking toward change at their own pace. Advocates carry small caseloads, no more than 20 at a time, to ensure the depth of the relationship and responsiveness that this work requires. They are not focused on compliance or quick closure. They are focused on engagement, repair, and stability. It's a layered relationship-based model designed to meet people where they are. It complements the structured offerings of existing systems and creates space for deeper engagement and sustained support. It asks us to slow down, listen closely, and build from the ground up. Let's shift now from research to real-world application. What happens when we take what we've learned and put it into action? RISE was born in Maine through a collaboration between Maine Adult Protective Services, the RISE collaborative team, and the Elder Abuse Institute of Maine, which is the organization that I lead. It's now being expanded nationally. It's 2-3 years in Toronto, David. And we're also doing training with other states, and we are in the process of replicating in 3 different states. RISE stands for Repair Harm, Inspire Change, Support Connection, and Empower Choice. The model serves older adults, as we noted, that are experiencing abuse, neglect, and exploitation. And these are often the most complex cases where people don't want traditional services or don't meet strict eligibility criteria or are reluctant to engage due to prior harm. RISE is not a service you can walk into. Every client is referred by APS, and we work with them at their pace for as long as they need. This could be weeks or, in some cases, a year. This isn't crisis response. It's accompaniment. It's showing up again and again. It's being consistent where trust has been broken. It's allowing the relationship to do the work. So in Maine, we launched in July of 2019, on July 8th. We've served over 1,000 clients to date. And our data shows that folks that have been involved in RISE as compared to those who have not, with similar case demographics and situations, are less likely to return to APS. So with those findings in the state of Maine, our DHHS commissioner approached the governor, and 2 years ago, the governor wrote the program into the state budget, so it's now a state-funded program. So RISE is grounded, as I said, in 4 integrated modalities. And this approach was designed by the team from the RISE Collaborative: restorative justice, motivational interviewing, teaming, and supported decision-making. These inform the 4 cornerstones we'll walk through next, offering practical strategy for engagement, healing, and sustainable change. This session and the way we structured it is intentionally designed to echo the core themes of this conference. Across these 2 days, we've heard a call for trauma-informed, person-centered, holistic, and collaborative responses to elder abuse. The RISE model lives out those principles in daily practice. RISE is in harmony with what you're working toward. It brings flexibility that helps your structured systems do more, reach more, and work better for the people at the center of all of this. Each cornerstone isn't just a value, it's a shift in practice. It demands something of us. These aren't slogans, they're muscles we've built through repetition and reflection. So obviously, these are the conference principles and how they align with the cornerstones in RISE that make up RISE. So trauma-informed, we refer to that as repair harm, person-centered and autonomy, empowering choice, holistic response, supporting connection, and interdisciplinary collaboration is inspiring change. So let's look at what this looks like in practice. So we'll take the core principle that you've been talking about for the last, one of the core principles, which is trauma-informed care, and we consider that repairing harm or a restorative approach. So this is what it looks like in action. Um, this case involves Thomas, a 72-year-old veteran who's been experiencing severe verbal outbursts and emotional abuse from his younger brother, who had recently moved in with him after losing housing. APS referred the case with an urgent request for placement, but Thomas didn't want his brother removed. He wanted him to get help. The RISE advocate began working with Thomas to understand what help looked like to him. At Thomas's request, the advocate reached out to the brother and helped coordinate a structured restorative conversation. With careful planning, ground rules, and support people present, Thomas expressed how the behavior was affecting him, and his brother shared the stress and shame he'd been carrying. Together, they agreed to new house rules, connected the brother to VA support systems, and created a mutual accountability plan. The abuse stopped. Most importantly, the relationship survived, and Thomas remained in control of the process. You don't just do trauma-informed work, as you all know. You build a trauma-informed system over time. That means holding space for repair before requiring change. It means building the kind of relationship where you can say no and know that your advocate will still be there tomorrow. The next core principle, person-centered and autonomy, we would call empowering choice or supported decision-making. This is one of the hardest shifts. Traditional systems often operate, as we know, from a safety-first mindset, which can unintentionally override client autonomy. A more complex example of supported decision-making involves Maria, a 68-year-old woman living with early-stage dementia who had recently experienced physical abuse by her long-term partner. Marie wanted help, but she didn't want to leave her home and she didn't want to press charges. Rather than making decisions for her, the RISE advocate helped Maria clarify her values and explore what safety could look like on her terms. With support, Maria chose to implement daily wellness check-ins, involved a trusted neighbor as part of her safety network, and worked with legal aid to create a protective agreement that did not require her partner's removal. The advocate helped her communicate her boundaries clearly and revise the plan as her needs changed. This was not about making the safest choice on paper. It was about supporting the safest choice that Maria could live with. Autonomy is not the opposite of safety. It's actually, in our experience, a pathway to it. When we create space for people to share their own plans, they're more likely to follow through. They stay connected, and connection is what keeps people safe. The next core principle, which you've been looking at, is holistic response, and we would call that supporting connection or teaming. This case involves Harold, a 79-year-old man living alone in a rural area who was referred after missing multiple medical appointments and failing to pay rent. APS suspected self-neglect. He was grieving the death of his partner and showed early signs of cognitive decline. Housing was threatening eviction, his PCP was frustrated, and no single agency felt they could take the lead. RISE convened a team across agencies and disciplines, but the difference was this: the client was at the center of that team. We aligned our work around around his values and goals, not just our agency mandates. Connection in RISE is not an extra, it's essential. Without it, older adults fall through the cracks. When systems come together around someone's reality, we create not just solutions, we create belonging. The last core principle is collaboration or inspiring change, which we would call motivational interviewing. So this is a 76-year-old man named Dennis who had been referred to APS multiple times over several years, a case we probably all know pretty well, due to unsafe living conditions and repeated refusals of support. Many providers had labeled him resistant, and services were often closed due to lack of engagement. A RISE advocate stayed with Dennis over the course of a year, sometimes meeting weekly, sometimes not at all. And in our framework, we call this dosage. With time, Dennis opened up. He eventually agreed to explore new housing, not because it was forced, but because he felt ready and trusted the person asking. The case never fit into standard success metrics, but Dennis stabilized, built routine, and did not return to APS. Sometimes it's not about resistance, it's about roles. Each agency has mandates to follow, timelines to meet, and definitions of success that are often set externally. That's real and it's necessary. RISE doesn't ask systems to bend their rules. We create flexibility in the spaces between systems. Think of it like connective tissue that allows agencies to stay anchored in their roles while still supporting people in ways that aren't possible inside traditional pathways. That flexibility allows us to stay longer, slow things down, or provide options when a client isn't ready for formal services. In RISE, this is how small wins happen, and those wins add up to stability, to safety, and lasting change. Sometimes the greatest barrier is not the client's resistance, it's the limitations systems face in their ability to adapt. And that's not a flaw, it's a reality. But RISE offers a complement to those systems. And again, we hold space in the in-between and support connection between systems, making it more likely that older adults can engage and stay engaged with help that's available. So it all sounds great on paper. It all sounds great in a presentation such as this. And on our best day, it only sounds great. But the reality is this is a really, we're dealing with individuals with really complex situations, layered challenges. And so there are benefits and there are also challenges to running RISE. So what's working? Clients report higher satisfaction levels, and we get this based on informal feedback from our clients and also some research we did a number of years ago. They achieve goals that they help define. APS, as I noticed, sees lower reoccurrence, and cross-systems trust improves. So agencies that we work with know the RISE model and know the approach, and so are more likely to bend and flex their rules to allow clients to meet their own goals. So that trust building across agencies is really critical to the success of RISE. But as I said, obviously it's not easy work. And this is where the agency and the support systems that we develop to uphold RISE are really important. So one of the challenges is flexibility. That flexibility can create tension, especially when autonomy and safety collide. I think that is probably, and David, I'd ask your opinion on this as well, that's probably the biggest challenge we face, is that, and I don't have to say any more about that, Andy said this in his intro too, that there is this challenge, right, between safety and autonomy. And when those things collide, which they often do, it creates tension. Staff need training, support, and supervision that acknowledges the moral complexity of this work. And we've had to learn over time what kind of supervision, whether it's clinical supervision, emotional sort of support, what kind of systems, ongoing education, professional development staff need to be able to sustain the work in this approach. And we're still learning about that. And measuring progress is still a challenge. Our systems weren't built to track person-defined goals. So some of you know goal attainment scaling, which is a method that can help us track person-defined goals. But honestly, we have to ask our staff to redefine what success looks like over and over again, because what you traditionally think of success, a client accepted services, they're now safe, they've left their perpetrator, are not always what we see. And so people have to constantly sort of redefine what success looks like. Systemic change doesn't mean abandoning structure. It means making space for models that can stretch where systems can't. And flexibility is necessary, but it's difficult. It requires trust, shared vision, and a willingness to sit with uncertainty. And that uncertainty we call holding multiple truths is especially true in the restorative approach, that we're asking people to understand that while we may see a person in an unsafe situation and we may not like as professionals what's happening to them at the hands of someone that's harming them, we have to accept that client choice is overrides all of that. So we hold those multiple truths, and it's not easy. So in order for the work to be successful, organizational shifts have to happen. So RISE, and what we've learned is RISE doesn't work unless the host agency shifts too. So we hire for values alignment, not just qualifications. Our staff come from many different backgrounds. We don't look for MSWs. We don't look for 30 years of work in the field. We don't look for clinical backgrounds. We have staff that have worked in victim services. We have staff that have worked in long-term care settings. We have staff that are new to the field of aging. We have staff that have been around for a long time. And what we look for in the way we ask questions and the way we evaluate alignment with the job, as we say, people have to want to do this work and they have to want to be here. And so we hire for value alignment, not just qualifications. We invest, as I noted before, in reflective supervision, which means that we try many different approaches and we bring multiple people into our supervisory structure. So in our agency, over the last couple of years, we realized that a person's supervisor isn't, that our staff needs something beyond day-to-day supervision. And so we hired a therapist, essentially, who understands the work and understands the importance of person-led approaches. And she runs a monthly meeting with our staff where they can talk about the challenges of this work with a neutral person who doesn't report to our supervisor. They can say things in that safe space, and they receive support and guidance in managing the complexity of this work. So again, we're always trying to figure out how best to support our staff. We also do book groups among our staff. So we choose books that staff, and it's optional, staff can join if they want. So, and we look at the larger issues like ageism. We read both fiction and nonfiction, just giving people different ways to connect and to connect their work to the broader community. We build in policy flexibility to support real-time judgment calls. So supervisors are always available to our staff. We never want them to feel like they're alone. And they know that they can come to a supervisor if they're struggling with the situation, especially in real time. And we emphasize shared accountability across partnerships. So it's really important that, I mean, our work is done in the field. We rely on all the systems that support older people in our community. And we attempt to create systems where accountability for services, for resources, and for a client-led approach is shared among the organizations that we work with. These shifts take time and they take intention, and they need to be sustained long after initial pilot funding or sort of the launch of a program ends. Sustainability in our world demands investment, not just in staffing, but in supervision, culture, and as I said before, the way we define success. So what are the lessons we've learned? They are many. They're a lot longer than this list. We have weekly conversations with our RISE collaborative team, which we've been having since, David, what, 2017, I think? We've been meeting weekly.
Yeah.
Yeah, and they're always interesting. They always go over. We never solve a problem. We consider the opening the door to one problem just leads to our next conversation. So here's the lessons we've learned. And these are just not the lessons of RISE. They're the shifts that this summit that you've all been spending your time in the last 2 days is calling for. What we're describing here is a translation of the principles you've been exploring into daily on-the-ground practice. So here's what we've learned through RISE, and I hope this is helpful to you as you go back to your teams. Principles are a living practice, not a checklist. Trauma-informed, person-led work requires reflection and recommitment. It isn't a switch you flip. You have to practice over and over again. Structure matters, so does what happens between structures. So as I noted before, RISE doesn't ask other systems to break their rules. It fills in the gaps between systems so that people can access support on their own terms. As I noted before, sustainability demands investment, not just in funding, but in time, supervision, collaboration, and curiosity. Progress is built from small wins, and this is huge. A return phone call, a client who sets a boundary, a safe moment of connections. These are the building blocks of our work. These aren't just lessons for RISE, they're the very shifts, as I noted before, the summit is calling for. The last I'll say is that system change requires patience. It requires ongoing reflections. It requires conversations that don't begin and end when you turn on and off your Zoom. And it requires a willingness to really understand what's happening for the people that we're working with and what's happening within our organizations that allow programs like RISE to thrive. So if you want to connect more, we'd love to hear from you. You can follow the RISE Collaborative on LinkedIn or X. You can visit our website for resources and updates on our national replication. David, do you want to say anything about the website or social media?
I don't think so. No, I mean, people are welcome to check it out.
Awesome. Finally, our research partners have published widely on RISE. These articles cover everything from motivational interviewing and teaming to APS recurrence reduction and goal setting and case resolution. This evidence is helping change not just practice, but by policy. We invite you to explore these articles because the more we learn together, the more effective and human-centered our systems can become. So in closing, we designed this session to put the summit's themes into motion, to show what they look like on the ground in real time with real people. This presentation was built with your goals in mind. The values you've been discussing over the past 2 days are not just abstract, they can be implemented. And I think RISE is evidence of that. Thanks for being here with us. Thanks for the work you do. And just in final closing, RISE isn't a model we created on paper. It's something we learned through real lives, real teams, and real challenges. And if today sparked a question or a curiosity or a moment of recognition, we consider that a win because we're all in this work together. I'm going to stop there.
Thank you both, Patty. I appreciate you both so much. We're going to move to a Q&A portion now, if that's okay with you. And you're welcome to leave your contact information up if you'd like. We have a few questions that have come in for you. One is about the restorative approach towards your intervention. And if you could say a little bit more about the restorative or the restorative justice component of the work that you're doing.
Sure. So if folks are, restorative justice is such a large conversation, and I always am cautious about diving too deep into it. But for those folks who know restorative justice, it's really a shift in how we think about addressing harm, acts of harm in our communities. And I think it is incredibly well suited for the work we do in the elder justice field, but it has to be adapted. So the restorative practices that I was first introduced to were in the juvenile justice system. And so there's a very traditional RJ model where folks sit, after a lot of pre-work, folks sit in a circle, we call it a conference, and there's very specific questions that are asked of both the victim and the offender. I'll use those words, the harmer and the person that was the recipient of harm. And those questions are: what happened? What were you thinking at the time? What have you thought about since? And what do you think you need to do to make things right? So that process is very orchestrated. It's incredibly transformative. And if you've never witnessed a restorative conference, I encourage you to Google it online. There are a lot of sort of simulations of a restorative conference. So when we think about RJ, that's a very traditional way of thinking about the practice of RJ. But what I would say is that the principles are so that they supersede the practice. And so the principles in in elder justice work are all the ones that Andy started with and the ones we've been talking about, right? Where we know that our clients oftentimes want support, most likely want support for their perpetrator more than they want prior to wanting support for themselves, sometimes even in lieu of support for themselves. And so how do we make that happen? It's the traditional conference that you would see in a juvenile justice setting is not necessarily appropriate for our work. And in the 1,000 cases that we've served, we've only done one conference. So what does that look like in our work? It looks like a mediated conversation between a landlord and a client who is being potentially evicted because of hoarding. The client is upset. The client doesn't understand why they're being evicted. The landlord is upset. Clearly something is happening in that apartment that makes it they can't sustain housing there. And so the work is actually trying to understand from the landlord's perspective what their needs and interests are, and from the client's perspective what their needs and interests are, and then helping to bring those folks together so that maybe the eviction can be averted. If not, at least the client is able to understand why it's happening. Those on the surface you may not think of as restorative approaches, but they really are, because they're talking about potential harm between two parties, and the impact of that harm, which is potentially the eviction of a client. So our work can look like that. It can look like a client who has been exploited by somebody, but does not want any interaction with that person, and has a hard time even defining to themselves that they've been exploited. The exploitation runs so deep, they have a lot of shame about it. And so our work with them would not be bringing them together with the perpetrator. Our work would be helping them understand that the harm that happened was not okay, and that they are okay to express that, right? And so we had a client whose neighbor had been exploiting her. She never wanted to see him again. She was afraid of him. The housing complex would not move him out, so she had to live near him. And so the restorative approach was working with her to admit that she felt angry at what happened. She wrote the guy a letter. She never sent it, but just the process of acknowledging the harm that happened and the way she felt about it led to more healing. So it's very situation based, but it isn't typical. It isn't a typical RJ approach that you'd see in juvenile justice system for many reasons that I can talk about at some other time. Hopefully that's helpful.
That is helpful. And for our purposes, can you just briefly say how that perspective might intersect with prosecution or working with MDTs that are also might be pursuing prosecution?
Sure. I'm gonna call on David. Are you still there?
I am still here, yeah.
Do you
I'm
want to
enjoying your insight here.
being off camera?
I think so because this is a client-led approach, if the older adult wishes to pursue prosecution, we will support them in doing that, right? I mean, we want to be clear that we're, it's just that that's not sort of the default, if that makes sense. And I would say that one example, and Patty, I'm about to pass this back over to you, but
Okay,
one
David.
example of where those systems intersect is actually in Seattle, where Patty and our colleague Kelsey, essentially delivered a restorative justice approach in concert, in combination with the criminal justice system as a form of diversion. And I don't know, Patty, if you want to just say a few words about how that worked, but I mean, I think there's certain cases that go through the criminal justice system that are perhaps more appropriately served by a restorative justice approach.
Yeah, and I think Paige Ulrey is here, so I don't know if
Oh,
that's
great.
something. I think I saw Paige's name on the
Yes.
screen. So hi,
Paige
Paige.
was central to that and huge role,
Yes.
and so
Yes.
huge thank you to Paige. Yeah, yeah.
And that was an amazing piece of work, because it not only helped it helped support the client, the victim, um, in what she really wanted was her grandson to get help. That's what she wanted. She certainly wanted the exploitation, which had been happening over a number of years and was pretty severe. She wanted it, of course, she wanted it to stop. But more than that, she wanted her grandson to get help. And there wasn't a way for her grandson to get help unless she reported it. And her grandson had a substance use addiction problem. So working with Paige and her team, we were able to propose an alternative to prosecution, which opened the door to drug court for her grandson. And drug court had not, Paige's, I hope this is, I hope I'm cool in sharing all of this, but drug court wouldn't not have accepted this case because the victim was considered vulnerable. But because they knew RISE would be supporting supporting both the grandmother and the grandson, they allowed it to go through. And I think that systemic change was huge, right? So our client, the client ended up going through drug court. He passed with flying colors. He, at his graduation, which we were able to attend remotely, the judge said that he was he went through faster than anybody else because, and that really showed them that actually cases where the victim is vulnerable can benefit from intervention, and a RISE intervention. And so we worked with that case for, I would say it's almost 2 years, working separately with the grandson, who had the support of drug court, and separately with grandma, who had the support of the AAA and an amazing program out in Seattle. Shout out to them and their wonderful work. So we could not have done, so Kelsey and I, our job was really very limited to the harm that had occurred between the two of them. But that wasn't the only thing that happened. Grandma got support, grandson got support. And ironically, in the end, they have not yet come together, but they both moved on towards healing. So it doesn't always end up with a kumbaya moment where everybody is loving each other again. They are loving each other from afar and much better off for it.
And Paige, I don't know if you're able to unmute or anything, but if you want to say anything, please feel free. I mean, this whole thing really did require Paige to have a lot of vision and throughout this whole thing. I'm not sure if you're able to talk right now, but anyways.
I'm here. I can't turn my camera on, but I am here, and I think you guys described it beautifully, and it was just really addressed this issue we were having with the prosecution, which was that what the grandmother Goldie really wanted was treatment for her son, not prosecution. And so we managed to leverage him into treatment through drug court and prosecution. And in the end, he completed treatment and the charges were dismissed. So it was what she wanted, which was what we could have hoped for.
And I'll say too that there were so many really transformative and powerful shifts in the whole process with the grandma and the grandson that, like, I know this sounds dramatic, but brought Kelsey and I to close to tears. And one of them was that, grandma made the choice to call the cops on her grandson and felt incredible shame in doing that. She thought she had ruined his life. And so because we were able to help reframe that through systemic change, what the message is that because she made that call, her grandson got clean. Because she made that call, her grandson got a job. Because she made that call, her grandson's living on her own. So it gave power back to her. And in the end, she as she was envisioning a relationship with her grandson again, she created a list of boundaries that she was going to uphold when she did meet with him again, which is incredibly powerful. And that happened over a course of time and gave the client something that I don't think any other process could have. We would love for more of that to happen. Paige, we would love to do that again.
We would too. And I think drug court was thrilled with it as well. So I think we've got lots of potential here for different courts to use this amazing program.
Yeah.
Well,
Nice
that
to
was
see
a
you.
nice synergistic conversation. We did not plan that, but it was so nice that we had all of you here and that you could talk about the work that you were able to do and how it benefited this client. And I think it also shows where that collaboration can happen, even if you're looking at expanding the trauma-informed and person-centered practices that you apply and kind of pushing those boundaries and it being more expansive, and also working in conjunction with prosecution and the criminal justice system. So that's really lovely. I do have another question for you. You had shown quite a bit of research around your program evaluation, and just wondering, don't know if we'll have another synergistic moment or not, but have you ever used any ripple effect mapping like Dr. Martinez described in her last session?
We have not.
We haven't actually. You
Well,
know,
I'll
but
connect you with Julia because maybe there's
I was
something
gonna
there.
say we need to follow up with Julia about that.
That sounds really good. And I think you might have mentioned something in the chat, but is there any RISE specific training that people can look for? And if so, where can they find that?
Yeah, I mean, I actually put a message in the chat there. We do have training that we've developed, and including training on, you know, modules on restorative justice approaches. And so I think if you're an organization that's interested in that kind of thing, you can feel free to reach out to Patty or myself.
Yeah.
Thank you. And so we know that a lot of people on the training here today, the summit, work with an MDT. And I was wondering if you could describe how your program might intersect with an MDT. And are you a referral for an MDT? Do you have a role on an MDT? If you could think about that framing a little bit, it'd be helpful.
We can talk about our program up in Ontario. So we and I know that Patty does this as well in Maine. I mean, so we do sit on several MDTs, you know, and part of that is to help kind of integrate ourselves into the space and into the community, and to develop partnerships and collaborations with others. But we do go to MDTs with cases. You know, we go to MDTs with cases that are, you know, we need some ideas on how to proceed. You know, so we use it as a resource. For example, you know, if there's a lawyer sitting on the MDT or something, and we know we need specific legal advice, or you know, just kind of brainstorming. So I would say we use it in both directions. We do sit on them. We also bring cases to them.
Yeah, and I would say in Maine that we don't have, I mean, we have variations of MDTs, but one of the things our staff sort of, when there is a community that's organized around elder justice issues, it is hugely helpful for our staff to be able to go to those groups, to those teams, and talk about, you know, both from a sort of systemic perspective, what actually is happening on the ground with the clients that we're serving, so that everybody is better informed about the struggles people face in accessing services, and the struggles people face that we may not even know about as service providers, but also to case consult, to David's point, de-identify case consult, because there's so many, as we all know, that's why MDTs exist. There's so many players, there's so many perspectives, and we're fortunate there's so many people that are invested in elder justice, but they all have a different role to play, and everybody has a different perspective and a different set of mandates, and we can only do our job well if we understand what those are. So MDTs are hugely valuable, and I think even the practices of RISE, regardless of, you know, it's a direct service intervention, but the perspectives of person-led, right? The perspectives of how can we really stop and think about what it is the client wants, and hold the tension between what we as service providers think the client should be wanting or should happen, that shift in perspective changes the way we think about delivering services. And so I think regardless of whether you do RISE or not, shifting your perspective toward a client-centered lens is hugely beneficial for the clients and helps us as providers not bang our heads, right? So that idea of resistance and thinking this person is resistant to services, shifting our frame to think about it's not resistance, it's where they are in the stages of change, what it is they're interested, what is valuable and important to them, really shifts how we as providers approach problem solving and support. And so I think that's valuable regardless of whether RISE is in your community or not.
Wonderful, thank you. I think that was all of the questions that we have. I really appreciate your presentation today and for sharing your contact information, because I think there will be more questions that will probably come your way after this information as it begins to percolate through everyone's thinking. So thank you.